Bronchial tree. Trachea divides at the level of lower border of T4 vertebra into two principal bronchi. The right principal bronchus is around 2.5 centimeters in length. It is more vertical, in line with the trachea when compared to left, making an angle of about 25 degrees with the trachea. Hence, inhaled foreign body pass more frequently to right lung and infections are more common in the right lung. Right principal bronchus divides into eparterial and hyparterial bronchus before entering the lung. These branches occupy the superior and inferior aspects of pulmonary artery in the hilum of right lung. Eparterial bronchus will supply the upper lobe of right lung, and hyparterial bronchus will divide into two branches which supply the middle and lower lobes. These are called secondary lobar bronchi. Left principal bronchus is around 5 centimeters in length. It is situated obliquely, making an angle of about 45 degrees with the trachea. Left principal bronchus will enter the hilum and divides within the substance of lung into two secondary lobar bronchi, which supply the upper and lower lobes of left lung. Each secondary lobar bronchus will divide into tertiary or segmental bronchi, one for each bronchopulmonary segment. Segmental bronchi will divide repeatedly to form terminal bronchioles. Terminal bronchioles further divide to form respiratory bronchioles. Part of the bronchial tree from trachea to terminal bronchioles is termed as conducting part, as there is no exchange of gases here. Respiratory bronchiole marks the beginning of the respiratory or exchange part, where gaseous exchange takes place. Respiratory bronchioles aerates a small area of lung known as pulmonary unit. Respiratory bronchioles leads to alveolar ducts, which leads to atria, air sacules and alveoli. Maximum gaseous exchange takes place at alveoli. 300 to 500 million alveoli are present in each adult lung. Bronchopulmonary segments. These are well-defined anatomical functional segments of lung which are surgically important. Each segment is pyramidal in shape, with its apex directed towards the hilum and base towards the peripheral surface. Each bronchopulmonary segment is supplied by one segmental bronchus and one segmental artery. But vein is intersegmental in nature, which lies in the connective tissue between adjacent bronchopulmonary segments. In relation to pulmonary artery, the branches of pulmonary artery accompany the bronchi. The artery is dorsolateral to the bronchus. Hence, each segment has its own separate artery. In relation to pulmonary vein, the pulmonary veins do not accompany the bronchi or pulmonary arteries. They run in intersegmental planes. Each segment has more than one vein, and each vein drains more than one segment. Close to the hilum, the veins are ventromedial to the bronchus. There are 10 bronchopulmonary segments in each lung. Segments in right lung. In upper lobe, apical, posterior and anterior. In middle lobe, lateral and medial. In lower lobe, superior, anterior basal, posterior basal, medial basal and lateral basal. Segments in left lung. In upper lobe, apical, posterior and anterior in upper division. Superior and inferior lingular in lower division, that is in the lingula. In lower lobe, superior, anterior basal, posterior basal, medial basal and lateral basal. Usually, the infection of the bronchopulmonary segment gets restricted to one particular segment. This can be used for segmental resection of the lung. However, it should be remembered that some infections like tuberculosis and carcinomas of lung break the barriers and spread to adjacent bronchopulmonary segments.